Okay, welcome to the weekly collaborative. Joe, I just had a long conversation with Dr. Dunn and her team, and we were talking about a range of things. But one of the things that we discussed was the role of health coaches in this. And I know that you've talked with her about my happy genes and
Mm-hmm.
perhaps getting involved in that kind of thing. And we were we were both kind of under the impression that health coaches have a unique role here because you tend to get engaged before, during, and after the whole process of patient diagnosis and treatment and thing, and you're kind of in a unique position. I'm really interested in your perspective on that.
Well, I think it probably differs from patient to patient, right? Because every single person is going to need support at a different point in time. And I love to use the analogy that when someone goes to a doctor, they're looking for a solution, right? They're looking to arrive at a destination.
Mm-hmm.
And that when you go to the doctor, no matter if it's a functional treatment plan or just a allopathic treatment plan, doctors are really good at laying out the steps. Like we have to do this and this and this and this and this. And that's great, to say that, okay, we're in New York City, I want to get to Times Square, you know, and you get in a cab and the cabbie takes you on a route and you're just kind of along for the ride. Um, Functional medicine is way better at having the patient navigate the route. But health coaches have the unique ability to be that navigator. So when they're at a crossroads, they're at a fork in the road and they have to make the change. They have to make the choice. They have to implement something and they're stuck, right? Or maybe they've hit a bump in the road and they've fallen over and now somebody needs to like motivate them to get back up and keep going. That's where health coaches can really come in and help guide the patient. And I think a lot of times practitioners lose clients and they don't even know why. They go, "Oh, I've talked to so many people, and I wish I could get a perspective from both sides and really get a clear idea because I'd love to do this analysis of, oh, I'm so good. People only see me 2 to 3 times and then they're better,
Or one time.
or one time and then they're better."
Uh,
But for a lot of us, we've all had the stories that I went to see him one time and I didn't have the heart to tell him that although I absolutely 100% agree with everything they said, there's absolutely no way I can do this. I need help. Or, yeah, went to see him 2 to 3 times and I felt good for a month and then I couldn't keep it up. I fell off the wagon. Um, and people really need that help and that guidance. Um, and every person's going to need a different level of health coach. I mean, maybe they need someone that speaks the same lingo as the functional medicine practitioner, but maybe it's just a simple dietary change that any health coach can walk them through, or a simple lifestyle change that any health coach can walk them through. So just like there's different practitioners, there's different kinds of health coaches, in different ways we practice.
Yeah, that's really helpful. You said something earlier that caught me, and I wanted to come back to that. You
Mhm.
said something like functional medicine. I don't know if you remember the exact words you said something like functional medicine is set up so that patients can be the navigator. Or what
Well,
was that concept, and help me
I
understand that?
think that in functional medicine, we're way better. Allopathic medicine tends to have this is the solution. It's one step. Take this drug. Maybe try some of this stuff. Maybe try to reduce your sugar and carb intake and take this drug. Like here, I have diabetes. Perfect example, right? Allopathic medicine would say, you need to stay away from carbs and sugary things. So, try and stay away from sugar and here's some metformin.
Hmm.
And we'll check back, here's a glucose meter, we'll check back. And that's it. On this end, we're like, okay, so why are your blood sugar and your metabolism off?
Hmm.
It could be XYZ. We're going to do this and we're going to do this and we're going to do this. And these are all the things I want you to do. And they're great at setting out a path. for this person to walk. It's multi-step. It gets to the root cause. It's brilliant. But as the person trying to implement this, the patient who's going to have to go through the sugar withdrawal, who's going to have to change their diet, who's going to have to now take X supplements and try to do all that while appeasing their family, it's a big ask. And I've talked to many people who have worked as doctors who don't have the time. I mean, they might want to, but they physically don't have time to handhold through that. And maybe they have staff that is there to answer those questions, but they don't know why the doctor necessarily said to do this. So then they always have to go back and ask the doctor and then go back to the patient, and there's this disconnect. And meanwhile, this person is like, screw it, I'm going to have the bowl of ice cream, or I'm going to have the pizza for dinner, or whatever, and it's too hard. I'm failing again. I'm done. I know what they said is right, but there's absolutely no way I can do this in real life. And they never hear from them again, and they think they've done great because they've never heard from them again, so they must be better. But in actuality, a lot of times, they've lost their way. The path was clearly set out in your mind, but the patient has lost their way.
So where is it ideally best for you to get involved in the process as a health coach?
I think from the very beginning. I mean,
so,
a lot
okay,
of
so
times
let's break that down, because let's break down that process. Because we've been spending a lot of time looking at all the steps of the process, and inserting something like what Dr. Dunn's doing puts a really interesting twist on it. So, typically there's the first patient intake interview, whatever form that takes, right? And then you go to testing. So blood testing, metabolic testing, genetic testing, right. if they go down that route, then those reports come back, and somebody who's skilled looks at those reports and says, look, these are the things that are going on. Your vitamin D levels are way too low, or your estrogen levels are way too high, or all that, or your genetic SNPs are saying, this is an issue.
Detox is blocked, guts off, all the things.
Right, all that stuff.
Yeah.
And so then they come up with a regimen of things to do. The old word is prescription, but I tend to stay away from that word. So they come up with a regimen.
They come up with it,
So
a plan, a map.
Where would you, in your ideal world, where would you plug in?
I think it really depends on the health coach. As a functionally trained health coach, I can do it, and sitting where I am in New York, I can do everything but order those labs. I can do a patient intake. I can draw a functional map. I can make the connections. Obviously the doctor who has probably served many more patients and clients, but as far as depending on how long they've been practicing functionally, we might be equal in how well we can connect dots and puzzle pieces. They may have insight, just based on whatever, but a lot of functionally trained health coaches have a lot of the same skill sets. And because we do more, getting people over those bumps and around those potholes and figuring out how this is going to actually weave in with their life and their lifestyle and, where they sit. And we can really get into the emotional piece and like what's blocking them from, what's blocking you from, making those changes, taking those supplements. Is it finances? Is it just you're too busy, too stressed, too whatever? Like, what is it? So it really, I think, depends on the coach, because as a functional coach, I would love to be in on that intake process. I mean, even if I'm just a fly on the wall, being in on that process to say, we are going to support you. he can order all the tests, or she, whatever. The doctor can do all of that stuff. And even if I'm not right there, to have a recording of that, right? So I can say, oh, did you ask this question? Because who's going to,
Or
they
did
don't
you think
want,
about, or did you think
right.
about they're
Yeah,
displaying those kind of symptoms? Or did you
right,
think about this thing? Yeah.
right.
Collaborating on
Like
the discussion, in other words.
we're trained to do something called 5-level listening. We don't only listen to what's said, but we listen to what's not said. And because we've walked so many people down the path and picked them up when they've fallen and messed up and done all these things, I think we have a different perspective. The doctor's looking at, not that they don't have, in functional medicine, we're taught to look at everything, right? We're taught to look at, what's the home environment like? What's your emotional state like? What's your stress level like? Because we know that all plays a part. But we've spent so much time in the trenches with the patient or client that we sometimes catch these subtle clues. And because because of that white coat syndrome that a lot of patients have, because they've been down this path before.
Right.
And they don't necessarily want to share everything with their doctor, right? They tend to be more reserved with them. But when we come at them as a coach, it's more of like we're going out for coffee. Tell me what's going on. For real, for real. Like, don't sugarcoat it. I don't care if you, ate an entire half gallon of ice cream last night. Let's talk about it. It's okay. I've been there. And I've walked a lot of people through this problem. Let's talk about it.
So that
So
time and that relationship you've got with them enables a lot more information gathering and a lot more
yes.
discussion.
Yeah. And there's so much. I've, so many times you're in that 90 minutes and you start down a line of questioning. I've worked with clients 2 months later. They're like, oh yeah, did I tell you I don't have a gallbladder? Like, I totally forgot to tell you I don't have a gallbladder. And that's only happened after hours of conversation, talking about everything. And then all of a sudden it comes up, well, yeah, there was that one time where I had to go into the hospital and it was really hard on my family. And we're like, you didn't write anything about a hospitalization in here. Oh yeah, I had my gallbladder out. Well, that's really important information. Like, you're missing an organ, or an appendectomy, or, like all these things. Oh yeah, I did have my tonsils out when I was 6. I barely remember it, like, because I was 6, right? So there's things that come up, or there's just things like, yeah, I didn't really tell the doctor this, but, they want me to, swallow pills, and I can't swallow a pill. Like, I've never been able to swallow pills. I definitely can't take that many. Like, it just won't happen. And I didn't have the heart to say it because they were so excited about this great supplement that was going to fix everything for me. So there's some level of that happens that I feel like health coaches can really exponentially increase patient compliance to the path that was set out. And sometimes we have to be that go-between to go back to the doctor and say, this was a brilliant plan, but it's not going to work for Susie because Susie just can't figure it out right now. So how are we going to get Susie to where she wants to go if we can't use this? Or something silly like, oh, Susie has a kiwi allergy and she can't take that supplement because it's got kiwi in it. Like, the prebiotic has kiwi and she's allergic to kiwi. Like, never would have thought to ask her about a kiwi, right?
Right.
Just weird things, or, Susie's whatever it is. Like, there's always things that come up after the fact that you've got to be able to just get down there and have that heart-to-heart conversation, and walk them through that. And if, as functionally trained people that can partner with functional doctors, we can sometimes say, hey, this came in and this isn't going to work. What do you think about this? It's going to save all that time and effort for the doctor to open that file back up, reacquaint themselves with that case, because they're seeing, maybe 10, 15 patients a day, depending on how many intakes versus how many follow-ups versus whatever, where a functionally trained health coach can literally, once that's done and the labs are reviewed, and we're trained to review labs too. We're trained to do the functional testing and look at those and put them in a functional, through a functional lens. So we can even, be a second set of eyes on all of that because we're trained. We just can't diagnose, treat, and prescribe. So when we have a client that's, rampant into type 2 diabetes and needs they need metformin, something's got to give, they need something triage right now. Prescription's got to, maybe it's a temporary, set of crutches, until things get better, but they need something now. We're not able to do that because we can't, that's not in our lane. So we need the practitioners. We need those people who can order the lab work, where we're not walking through that brick wall of, why do I need a full thyroid panel? Why are you asking for a fasting insulin? Why do we need, oat markers? All these things that allopathic doctors have no idea what they're for. Why are you asking for red blood cell minerals? All these things that are outside of the standard protocols in allopathic medicine, we're going to speak their language. We're going to know what they're talking about. When they say we're doing a gut protocol, we're like, okay, let's do it. Or we're dealing with SIBO. Okay, let's do it. We know the path they're walking them down, and we can help guide. And then if we see something that's off, we can go back with a recommendation, clear it through the doctor, and that saves them so much time because we understand what they're doing on a foundational level. Now
So
if you're just looking...
Remind me, are you working strictly in functional medicine now? Are you working with any allopathic doctors, or in your own practice?
In my own practice, I'm not working directly with any physicians right now. I whoever comes to me, I'm writing letters to allopathic doctors, trying to give them the ammunition to be able to ask for a lab. So when someone comes with me with perfect, TSH, but they're still exhausted, they're still constipated, they still are gaining weight, they still have hair loss, all the symptoms of hypothyroidism, but their TSH is fine, and they're, the numbers that the doctors have run give them no indication that anything's up with their thyroid, but they're showing all the symptoms. I can go through and say, I've been working with XYZ, with so-and-so for so many weeks, months. I know her standard labs have come back, but this is what we're seeing. And these are the symptoms. They all can be tied back to suboptimal thyroid function. Can we please, using these symptoms and her extreme fatigue and her weight gain and
or these tests,
order a full thyroid panel?
Right.
To gain more insight to see if it truly is her thyroid. Can we run a reverse T3 to see if there's adrenal involvement?
So
maybe it's her stress blocking it.
I'm supposing if you're talking with a functional medicine physician, that conversation is a lot shorter.
It is.
Right.
It is. If I can get them to see a functional person, then it's we've got XYZ. TSH was, a little off, but we're still showing all the signs. Can we have a full panel? And she also has this autoimmune condition. Maybe it's now crossed over and affecting her thyroid. We also need thyroid antibodies. Because maybe she's got Hashimoto's, or maybe it is just 100% stress. And her body's protecting her by blocking, conversion to T3, and it's taking it all to reverse T3. Because the body's not stupid, right? The body knows what it's doing. It's doing it for a reason. So we have to look at this person in this unique situation, and maybe that person hasn't said, yeah, I'm totally stressed out because of XYZ, because they haven't even made that connection yet. And the doctor's not asking those questions, but a health coach is, right? A health coach is going, all right, talk to me about your day. Like, seriously, talk to me about what went on this week and why you ended up on the couch with a half pint of Ben and Jerry's and a bag of barbecue potato chips watching Netflix rom-coms, right? And
Happens.
crying yourself to
Happens a
sleep.
lot.
Right? Like, why? And why is this not just this week, but this is a regular occurrence? Right?
Mm-hmm.
And you know, when we can sit there and like spend the time to educate them on what's going on, why it's happening, how it's affecting stuff, and why they need to make the changes, and have those conversations. And they're not always going to do it with the doctor, and the doctor doesn't always have the time because they're booked into the next person.
Right.
You know, they're not, you know, and that's where we sit with people. I mean, in the muck, figuring out why they can't make the changes, why it's not working for them, making them understand, you know, why doing those things is really the thing that's going to move the needle on their health. You know, and it's that big education piece, you know, and sometimes we do it on one-on-one. Sometimes, you know, we've got 5 people, you know, 5 women, all the same, you know, demographic, all the kind of living the same life, having the same kind of challenges, and we can throw them all in a group and they can support each other and we can just facilitate that.
Mm-hmm.
You know, and that's where we sit in answering these questions and just being there. You know, and that's kind of what Rald and I are doing is we're giving a space where they can call and ask the stupid questions, the questions, you know, they don't want to bother their doctor with. They don't want to take the time. They don't want to pay for another consult or appointment just to find out, like, does this really contain gluten? Can I eat this or not? You know, my doctor told me to take vitamin D, but I heard I'm supposed to take it with a K, but,
Mm-hmm.
you know, I'm on a blood thinner, so I can't take K, can I? You know, like all these questions that you don't think of when you're, you know, here's the 7 things I need you to take. You know, all these questions. So we're there to answer the questions. We're there, you know, to facilitate these groups, and we're there to, you know, if a program's needed, to implement that program in your practice so you don't have to do it, because we've done it. You know, we've taught people about women about their hormones. We've taught them about their thyroid function and how stress affects it. We've taught them about why they need to go gluten-free and why they need to take certain supplements and what they do. And I mean, all that education, because if they don't know why they're doing it, it's very easy for them to say, oh, that's not really important.
Well, and to your point, the point that you made earlier, you're also riding along with them over time to remind them,
Yeah.
you know, that they, oh yeah.
Yeah. It's that accountability piece, right? Because it's really easy to let 7 days go by or 2 months or 3 months between. I mean, like, okay, so I sat down with a functional medicine doctor. They've laid out this plan. I'm not going to see him again for 30 days. Well, for the first week, you're just processing,
Mm-hmm.
right? I mean, and then at some point between 7 days and 14 days, you're like, oh crap, I probably should have gotten those supplements. Or I got them and they're still in the box. I haven't even started taking them. I probably should start taking them. And then you get a bump in the road and you haven't started taking them. You haven't gone shopping for the right food. So you know, you've got to finish what's in your cupboard. All these things happen. And then all of a sudden I'm meeting with the doctor next week and I've only done, you know, a quarter of what they've asked me to do. And that accountability piece was lacking. You know, and there's
Right.
only so much if you're running a busy functional medicine practice that you can do to follow up with these people. So now all of a sudden they've spent a lot of money. You've given them a very clear-cut plan, but 30 days have gone by and they've only implemented a quarter of it. You know, and
Well,
yeah,
it's easy to do. I mean, I you know, even outside of the care of a doctor, I suspect a lot of us have had this kind of scenario where, you know, I do some research and realize that, hey, it's important that I have magnesium, or it's important that I have, you know, vitamin E or something like that. So I have a bottle of it, and then
Yeah.
the bottle's empty. You know, a month later, it's like, okay, why did I need that? And
Right. Why did I
that
need
then
it? Why
that
am I taking it? Did you
that falls
reorder
off
it?
the
Yeah.
list, and and
Yeah.
yeah,
Yep.
exactly.
Yeah. Or you're not taking it, but the doctors put you on autofill, right? So now your second bottle has arrived, and you're only halfway through the first, and you're like, ugh. Now you're stockpiling some expensive supplement. I mean, I've been there. I've been given a $90 bottle, $90 for a month of a probiotic that I was supposed to take. That on day 28 made me break out in hives
Hmm.
because it wasn't the right one for me. And there wasn't a second set of eyes on it to say, oh, wait, this is contraindicated for this person.
Hmm.
Like someone with a mold and yeast problem shouldn't be taking Saccharomyces. And yes, it's the best thing to heal your leaky gut, but it's contraindicated in anyone with a mold or a yeast issue. And
Yeah.
it was just, this is the protocol for leaky gut, slap it on this person and miss that piece. And we all make those mistakes, but a health coach, to have someone that walked through that, might have caught that. A second set of eyes that was functionally trained may have caught that because it was
And had more information from other conversations about
right
what else is going on with
to
this
fill that
person.
in. Like, oh yeah,
Yeah.
did I tell you that I have this mold thing? Like it might not have gotten through. Like, I mean, it's one line on a health history form that's 15 to 20 pages long. Like, you very easily can miss the checkbox, right? I mean, it happens to all of us, but it's those conversations, it's that connection, it's having someone else who's functionally trained. And we know that teams do much better supporting. It's not one practitioner that's going to get a patient from sick to well. It's a team of people. It's different lifestyle changes. It's different diet things. It's all these things combined that get them there. So,
Well, it's really fascinating and heartening for us, and perhaps it's because we're so hyper focused on it. We're living it every day, and we're talking to all the people. But it seems to us there's this rising tide of awareness with patients and their caregivers and practitioners that this is the right way to go. And so
yeah.
more and more people are looking at that and taking, as you said, taking responsibility and navigating through their own health journey.
Mhm.
And like realizing that pill to adjust those symptoms was not the right thing to do. And the other 12 pills that I'm taking, I have similar stories. And I mean, it's
Yeah.
so, so back to the subject of genetics and epigenetics and methylation and all the work that Dr. Dunn's. I mean, I'm really, so how are you thinking about that? Where does it kind of fit into your picture?
That was the linchpin that kind of made everything fall in place for me. I became a health coach in 2012. It was during the detox cleanse craze,
Mm-hmm.
seasonal, everybody was doing them. I was doing them. I was taking patients and clients through them, feeling great for the first few seasons. And then all of a sudden, I wasn't. And I didn't know if I just told myself that I was too busy, too tired, doing too many things, and that I really wasn't gonna I was doing them alongside my clients, right? Because why not? I mean, it's great, healthy, whole food. We weren't using anything other than maybe supporting the body with a probiotic. It wasn't pushing extra, it was just a whole food kind of thing. But after running those, and then that was 2013 into 2014. The end of 2014 was an extremely stressful year. I say it was the year of 7 deaths. We had seven it started with people that we knew who had significant others that passed away, friends that we knew from, like high school people. Then it kind of got closer, aunts and uncles, grandparents, and finally with my
Your
brother.
brother. Mm-hmm.
Right? And during that time, the stress on top of everything that I had done up to that point to be healthy, which I thought was good for me, I realized genetically my body wasn't taking it. The stress along with my sluggish detox, my missing gallbladder, put me into a place where my adrenals were done, my gut was toast, and I was covered in hives. And it wasn't until I had my genetics done and I realized that I had the MTHFR and I had some histamine issues, that I figured out what I needed to do to reverse all that. And I also, I don't know if you know this, I went to college. I was going to be a genetic engineer. That was my
No,
goal.
I didn't know that piece.
Yeah. Yeah. So I left high school thinking I was going to like be the genetic rock star that cured all the world's diseases. And then I got into the lab and realized I could not be a researcher. Like I just needed more people. And I liked people more than test tubes and microscopes and, petri dishes. So I just couldn't do it.
And guess what? Spin the clock forward, and you are that rock star who's curing people's disease. Just a different way.
It's just a different way. I just knew that the research lab wasn't for me. I love reading that stuff. I love doing all of, but when I can finally get someone's genetics along with all the other testing and go, well, here, like this is exactly what it is. That roadmap, those pit hole, those craters and boulders and things tend to just disappear because now we know, right? There's an issue with methylation. Like this person's methylation is something we have to watch. This person's whatever, COMT, this person's, whatever the genetic SNP is that's not quite optimal is something we need to be aware of.
So two questions. So where does that testing come in the process with you? Like where do
every single person is different because every single client that I meet with has a different level of financial commitment they can make. I love saying let's test, not guess, but at the same time, what's the harm in switching people to a more absorbable complex B vitamin and just making sure that they have a base level of good Bs if they can't afford to get the genetic testing. Mm-hmm. Where I sit in New York, the functional tests aren't available always. They're not covered by insurance a lot of times. So, I mean, even regular standard labs, I'm working with like whatever labs the doctor runs and, writing a letter and keeping my fingers crossed that I get some more labs, but they come in piecemeal and then they're not always useful. Mm-hmm. I'm like, right. If you don't get the complete panel, to match apples to apples, you're comparing apples and oranges, and sometimes you can't really make that connection. You're just theorizing some more again. Like, well, this was suboptimal here, and you can't do that. So, I would love all this testing to be available cheaply and, every single person to come and have a full workup and have everything done, right? So we get a great, awesome picture. Well, but it is still one snapshot in time.
Yeah, that's not,
and there are still blind spots even with that lab work. I mean, there's no way to tell intracellularly how thyroid hormone is being converted in the cell. Like that, you can't test that with anything. There's no way to really tell unless we grind a person up and like how much heavy metal their body is storing. I mean, we can see what's in their hair, we can see what's in their blood, we can see what's in their urine, right? But there's no way to like really truly know how much is hiding in their thyroid or someplace else, right?
And to your point, those tests have to happen sequentially over time, and that's also costly.
Right. So then you've got to repeat them. Like it's a so there's a limiting factor there for people who can't, they're scraping up the money to see a functional medicine practitioner, which is generally outside of insurance. Then they're scraping up the money for extra testing, because a lot of times the doctor's like, I can run it, but insurance might not cover it. And then they're left holding the bill at the end of the day.
Right.
and that's not always, then they're back looking at you going, what do you mean that that one test was $150? Was it really that important? And then when it comes back inconclusive and it didn't give you any more information, that's the problem.
Right.
Then they're looking at you like, what the heck?
Well, I don't know how far you've gotten in this with Dr. Dunn, but she's been working with Bill Beakey in the professional co-op. She gives that. Yeah. So that's one of the things that they're driving to do is, and they already have taken thousands of dollars worth of tests and brought them down into the sub $1,000,
Yeah. No, that's awesome.
$500 range. Yeah. And that you're absolutely right.
But that's still for some people like.
Yeah, exactly. It's still off the charts for some people. Yeah.
Yeah, it just depends. I mean, and a lot of times these people come to us after they've spent a fortune in allopathic medicine,
right,
and haven't gotten an answer.
Right.
So now they're defeated. Their bank accounts are stressed. They're stressed. They're not any better, and they're really searching, and they're mortgaging their house again to try and find an answer. I mean, so yes, they want to know, but they're stressed. So a lot of times we get them in the health coaching world because we can do things maybe a little bit cheaper and outside the box, because we're not running all the tests.
Right.
So we bring them as far as we can, and then it's like, okay, it's imperative now that we've come as far as we can without data. We've done all the things. We've taken care of all the low-hanging fruit. We've optimized your diet. We've optimized your stress response and how you, frame and handle stress. We've optimized your sleep. We've optimized, you're pooping every day, you're sleeping, you're doing all the things, but we're still dealing with X, Y, Z. And now we really need to bring a practitioner on board that can run these tests, that can do these things. And insurance, your regular allopathic doctor is not going to do it. How can, now we're here,
So second question. So let's say you've got somebody and you've done the metabolic tests, you've done the genetic tests. You said earlier something very interesting. You said that was the last piece that fell into place for you with the genetic stuff. So you have the ability to look across all those tests. So can you talk to me a little bit about, so what's that telling you? You got their blood panels, you got their genetic stuff, you've got,
Well, in my particular case, I really thought that I had no idea that I had a methylation issue. I thought I was taking the right B's, the right this, the right that, doing the right things, right? Because I'm smart, I'm trained, I do this with people all the time. But I didn't realize exactly what was going on. It wasn't making sense to me. Like, I just couldn't wrap my brain around why my body was acting the way it was, because I was doing all these things. And then once I realized that I wasn't releasing toxins, like my body was holding on to them because that pathway was blocked, and that my body didn't really clear histamine all that well, it was really simple. It was like, oh, okay, I understand now why I'm here. So one, I know how to fix it, I know how to reverse it, and I know how to not to get here again. So my body still has like things that it reacts to. Like, I'm not wearing my wedding ring today because I have a rash here again. Like, I broke out something, I reacted to, and my body reacts. And and that's it. Like, but if you would have seen my before and after.
Maybe you're allergic to being married, maybe.
Well, it only started happening. My wedding ring broke, and I brought it in to be repaired. And I don't know what they used in the solder or whatever to reset my ring, because I didn't used to react to my ring, and now I do. So there's something like, if anybody out there knows what that might be, let me know, because it's really bothering the heck out of me that this is the only place now that I react.
So given what you said earlier, so in an ideal world, would the genetic test come first? If you could have, if a patient could have all
Yeah,
those,
I mean, I would love, yeah, because we really kind of need to know, do they have an MTHFR variant? Is that, you know, because I mean, if they're taking the wrong kind of B vitamins, I mean, it's to me, the stuff I was taking was poison. My body was not
hmm,
handling that well. It was just adding to the burden. So all these things that I was doing that I thought I used to be the queen of fermenting. I made my own cheese. I made my own yogurt. I made kefir. I brewed kombucha. Like there was always something. My husband used to say, "What's rotting on the counter now, dear?" I made my own sauerkraut. Like I was big into fermentation and doing all those things. And then when I find out that there's a mold and yeast problem and I can't have anything fermented
wow,
because it's high histamine producing and my body doesn't clear histamine, like, I mean, that's what everybody says, right? Like, all
right,
that stuff is really good for you. Well, it's like anything else, it's good for some people. It was not good for me. Now, I can enjoy some of that stuff now without literally being covered in hives from my nose to my waist, because, I mean, that's what it was. And I think I've showed you pictures.
hmm,
It was incredibly, incredibly, like, bad. Um, but it, yeah, I mean, that was kryptonite for me. And I had no idea without knowing my genetics that was
So,
my,
so when you get a new client and you're trying to figure out the situation, if money is not an issue, and I know that is for a lot of people, but um,
yeah, I
so
would love,
you do the genetic stuff, you do the metabolic stuff, and get the whole picture,
right.
ideally.
Yeah.
I think I might have told you or said this on one of our previous weekly collaboratives, but I mean, I asked that early in our discussions. I asked that question of Dr. Dunn. I said, where does somebody start? You know, because you hear it's sleep, you hear it's nutrition, you hear it's removing stress, you hear it's exercise, all that kind of stuff. And she laughed and she said, I used to think the same thing, but then I realized through a lot of work with patients and my own issue, my own health journey, that if unless you understand the genetic aspects of it and you get your brain chemistry right and you get your body chemistry right, you're not going to feel like eating right. You're not going to feel like exercising. You're not going to sleep well.
No. Well,
You
and
got
the situation, the seat I was in, I was reacting to everything. I had no idea because I was so hyper reactive at that time. People threw around multiple chemical sensitivities disorder, histamine, mast cell activation disorder, like all these things were thrown at me as possible labels, and my solution was antihistamines and steroids, like for life. Like,
right,
you just need to have these for life. And I said, I'm not taking those.
which is
I
very
took the
dangerous.
antihistamines. Yes, I took the antihistamines because I was scratching myself till I bled every night.
Mhm.
And that wasn't good. Um, so that was my triage. But I said, there's no way I'm taking steroids because I need to know. Like, I need to react on some level to know what's bad and what's good. Like, I need to get to a point where I can discern when something, what is my kryptonite? What is that thing? And it was a savvy naturopath that sat down and said, well, hey, you reacted to this when you were little, and this, and you've had all these things, and this could be fungal, and this, you said that you cured some of this stuff by, going on like an anti-candida diet back in your early 20s. Like, obviously, this has kind of been an issue all along. Like, do you see where mold and yeast and funguses and all this stuff has been an issue all along? And I'm like, oh, wow, okay, like since third grade, really. Like, all right,
Well, and look at your case as one case study in that, and look how much time, effort, money, things you put in your body or on your body to address those
mhm,
things. You're
right,
potentially tens of thousands of dollars, if not more,
Right,
over
right.
time.
And that's the thing. And you don't, every single client that I handle, I mean, I ask these questions like, where do you want to start? You know, how much testing do you want to do? Are you a test, are you data driven? Because sometimes data doesn't motivate people. They don't, like, okay, that's fine. But at the end of the day, I'd love to have all those tests, but I don't have the money for it. Or I'd love to do all that stuff, but, I just, it's not really important. I just want this. It just depends. Everybody's different. So I try to meet people where they're at and really, I'm the one with the roadmap that says we can take the highway, right? It's going to cost us less. It's going to get us there faster. It's going to cost us more and but it'll get us there faster. Or are you more of a backcountry road kind of person that you're willing to do some twists and turns and ups and downs and enjoy the scenery and take a little bit longer? We're going to save the money on the tolls, but, it's going to take us a while.
Mm-hmm.
And I let people guide their own path, because some people, like, they're afraid of needles. They don't want to get tested. They're very leery about getting genetics run because they don't want anyone else to know, like, what is that going to be used for? Like, who's going to have that information? Is that private? There's this whole ball, and then if we work together for a while and we hit that wall, sometimes they're more open 3 months in, and I can say, hey, look, we've worked together for 3 months. Do you trust me or not? Like, here's an avenue. It is private. Your info won't be shared, but knowing your genetics would be really, really helpful. We're not going to do an ancestry. We're going to use a medical company. It's private. It's not, like all that stuff. But
well, that's
it is
one
1
of the
o'clock.
reasons why
Daughter's waiting for me.
Oh,
I just looked out. We've been chit-chatting so long.
This has been so great, and I mean, this has been like a little mini course in health coaches, and you've opened my eyes so much to the role of your profession and how much value it adds, and all the way along the way as we've been discussing, in this. So this is.
Yeah, and like I said, when I started in 2012, I was it was a health coach. I mean, I taught people how to make better choices at the grocery store. I did grocery store tours. I did pantry cleanouts. I ran those Whole Foods, where, I taught people, like, okay, this is how you make a smoothie. This is how you, water, make your water taste better so you can get off the soda and the coffee. These are.
And here's not how not to make a smoothie.
Right. Just really simple, basic things, which all have their place. But coming up through with my research, coming up through genetics, right, and biochemistry and that kind of, because I went from being a genetic engineer to being a science teacher, to then staying home and raising my kids through all the stuff that went on with them. And, that's a whole nother story for another day, because my daughter is sitting outside of her music teacher's house right now waiting for me to pick her up. And, to realizing that I could only help people come so far, that was super low-hanging fruit that I could help them with. And yes, people need that. But then comes a point where you have to be able to talk the lingo of, this is connected to this, is connected to this, and this is how it's affecting your body and your biochemistry, and this is how stress is doing it, and it's doing this in your body. And because of this dynamic, it's really, really important that we make these changes. And this is how it's going to help you. And to be able to actually say what the doctor said, right? That brilliant physician, and be able to break it down into terms they understand, so that then they're motivated to make those changes and make them sustainably for them, because everybody's different. Some people are still going to eat at a restaurant 80% of the time, but how do we navigate this new way of eating if they're going to be not cooking food because they just don't have that life? Yep. Right? They're too busy. They're too whatever. They don't have time. I mean, even people that are working from home, they're still working from home 16, 18-hour days.
Mm-hmm.
They don't have time to go prepare lunch for themselves. I mean, like, how do we get them to do that? Versus the mom that's just home, that just needs to learn the skills that they weren't taught.
Mm-hmm.
Because they grew up with a mom who,
Fast food.
had rice-a-roni and a can of beans, right? And, the stick this, in the oven and peel back the foil a little bit, and there's dinner. Everything
Well,
was.
that was a great summary. So you go get your daughter. Thank you so
Yep.
much for this Health Coaches One-on-One. It
No
was
problem.
brilliant, and have a great rest of your Thursday.
All right, you too.
Bye.
Bye bye.